Well, Carrie Gray Outen, where are you? Which island are you on?
I'm on beautiful Maui.
Beautiful Maui! But oh, that's why it's so beautiful there that you want to make the whole country beautiful by starting, really, it's almost like a new health insurance industry for alternative health care, right? Because
Yes,
nobody's
absolutely.
nobody's insurance for this stuff yet, and you're going to be the person in the world to make sure these companies start insuring alternative practices. What got you into this?
Well, actually, it's been quite a journey to get here, and it started with my own diagnosis of cancer.
Ooh.
27 years ago. Obviously, I'm still here, so you can see that my diagnosis was wrong, and that
Really?
I actually survived, but I only survived because of alternative medicine. And
Wow.
that's why I've become such an advocate and such a proponent of how alternative medicine can save lives. And
Yeah.
it's lives that people don't need to squander waiting for conventional health care to get this figured out, because clearly they're not going to figure it out.
Right. Well, there's no money in for them or whatever, so you're proving to them. By the way, at 26 years ago, they said you were going to die from this?
Yes, I was diagnosed. My cancer was terminal when it was diagnosed from a simple, just a physical. And that was a real bomb, to say the least, when
Wow.
that's dropped on a person.
You had
when
kids at
you're
the
young.
time? You had kids,
Yes,
children?
I had 3 children, and
Wow.
very, very scary time for sure.
Wow. And it was alternative medications or procedures that cured it for you, because traditional medicine was not not going to offer it to you, and that's where your health insurance paid for, right?
Well, actually, and then that's the next problem is there was no health coverage for my modality of choice, which was alternative,
Right,
as
that's what I
the
mean.
only option to save my life. And of course, I didn't know how the story would end. And my insurance flatly refused to cover anything. And that's really what created in me this desire to pay it forward, right? To help other people, because I recognized going through this that the system is very broken, and it's really something you're not going to fix,
Right.
waiting for the system to fix itself. So
you,
Einstein, I appreciate what he said. He said that you can't use the same thinking to fix a problem
exactly.
that you used to create it.
yeah, you got to get different people in there.
That's right. That's right. So,
But so you say, I mean, you're trying to get alternative health care to people who needed to save their lives, and I guess the options, what goes through my mind, either you get a law passed, which is forever, and nobody wants you to do that because they're going to lose money, and so everybody's going to fight you. But your new organization, which is My Green Assurance, is going to collect, tens of thousands or millions of people that say, hey, we want it, and an insurance company says, hey, there's money there for us if we can buy this kind of insurance.
That's right.
So you're using the proper incentive for these insurance companies to provide this.
that's right.
Yeah,
And
that's
we call
brilliant.
it put your money where your choice is, right?
Ah, right.
Yeah. So people have the power, but
Yeah.
what they need is the organizational
Yeah.
structure to put that choice into one unified voice, and that's
Well,
really what we're doing.
it's like a crowdfunding platform you have then. So you're getting the crowd to chip in, hey, here's $10 or whatever. Yeah, I believe in this. And then when you get enough people to make it of interesting to insurance people, right? Hey, we're going to cover that with this many people.
right. That's
We'll
right.
work that out.
Exactly.
That's brilliant.
That's
So
right.
you're a nonprofit now. You originally weren't, but now you're going to be a nonprofit, correct?
That's correct.
Yeah.
Right. So we're a 501c, which means that any donations we receive are all tax deductible.
I see.
That's a big incentive for people to help us get this going.
Right.
Yeah.
No, I would think so, because what frustrates a lot of people is they can't get coverage, and that's still going to be a problem in our society, even with Obamacare, because none of that is covered in alternative medicine, which is an important thing. We're financing alternative research at National Institutes of Health, but very little. It's not much, and people don't realize it, but I believe in it. I mean, a lot of stuff I've done recently, my aches and pains of older aging, going to alternative physicians kind of thing. They're not even physicians, but they're able to cure me. And that's what counts.
Yes.
Yeah.
Yes.
Yeah.
Alternative practitioners have really been treated like the redheaded stepchildren.
Yeah.
Yeah.
Right.
They've been really ignored and have been very discredited by the medical community. But, it's okay because people, their choice is still being very clearly known by anticipation right now this year of about $100 billion is going to be spent on things that are classified as alternative. So
I see.
People are making their choice very clear, and they're not going with the status quo, and they're not going to be bullied or intimidated into staying with it, even under federal penalties of some kind of taxation.
Yeah, no, I mean, and I feel sorry really for traditional doctors. I mean, they put you through they're like a cattle. You feel like a piece of cattle. They come through, they spend 5 minutes with you, and their hands on the doorknob, want to get out of the door to go to the next person, and they're in a healing position, to help people, and they spend no time with you to really help you.
Yes, because it's become too much about the money, hasn't it?
Yeah.
That's really it's got to be bigger than about the money. It's got to really be about people. Healthcare is a very private.
Exactly.
Right?
Yeah.
And it's something that's very intimate.
Yeah.
And you need to feel that intimacy with your care provider. Yes.
And also and most of them just tell what's wrong with you by looking at pictures of something, They want to diagnose you not with you but with some picture of you, the guy didn't even touch me, Right. How the hell does he know? Well, this is wonderful.
Yes.
So now you really believe in this because I think you mentioned last time you gave up your job for a while just to concentrate on this, huh? You gave up working for a while just to concentrate.
I've been on this.
Yeah.
I've been on it for a year now.
Wow.
So I've really poured myself into this, needless to say.
Well, that's right. And your daughters are all grown now? Do they understand crazy mama or what?
Oh, yes. Yes. They're very supportive, and they are advocates themselves and proponents of alternative medicine because they, too, know it works.
Yeah. Well, no, I believe it. And more people do. I mean, they see it, happening. And man, I mean, that's you want to get something that works, and they don't teach any of this in the med schools. Maybe someday they will or something. But I guess if a pharmaceutical company can't make money on it, they're not going to teach them. Yeah,
and that's really what we got to get back to, isn't it?
Right.
The greed factor. Yeah.
Right.
So as long as the greed factor is in all of this,
Exactly.
it's not going to get any better, and that's why we can't rely on the system to fix itself because it's never going to fix itself.
No.
There won't be cures for disease because there's no profit in cure. There's profit in treatment.
Exactly.
There's profit in making lifetime customers.
Exactly.
That's where the profit is.
No, I saw it in my folks and everything. That's why I just stay away from medications or anything, man. Just mask the real problem, or whatever it is. So it's My Green Assurance, and you have all the information there, and you have a great new video you just did too. You said that explains this, what's going on there. Then if people could donate, it's sort of like a crowdfunding thing, and for as little as $10, you could be part of this movement. To get an insurance company to show that there's enough people that really care about this stuff to work as a single voice and money. They know what money is, so when they see 100,000 people,
that's right.
That's money and big enough for them to get involved. Well, I appreciate so much for you taking your life now and devoting it to making sure other people know about these treatments and get it paid for like an insurance. Why be a stepchild if something's going to save your life, right?
That's right. Well, and the thing is that, when you have your life saved by something, that's a moment that you'll never forget, right? And the only way that you really feel that you live up to what getting your life back does is by paying it forward.
Absolutely.
And that's the least I can do.
So you're like the fireman, bringing somebody out of the flaming house, and then all of those people are going to do it too.
Thank you, Matthew. Thank you.
Well, that's wonderful. So it's My Green Assurance. Go there and find out about this, and we need alternative medicines, and we need to get it paid for like all those other bureaucratic medicines we got. Yeah.
That's right. That's right. Let's put a voice to our choice, and let's do this together.
Wonderful. Well, thank you, Carrie. Thank you for
Thank
being
you.
there. Yeah, and I
Aloha.
wish I was there in Hawaii. I'm freezing out here in Washington.
Oh,
Yeah.
thank you. Well, come and
Okay.
visit anytime. Bye-bye.
Okay. Thank you.